quickly and send it over to our brothers across the hall and sisters. Sorry. And so, as I said, it's good to see y'all here, and we will get started. Are there any questions from the committee at all? Okay, well, I hope this will be a very open dialogue. I want to remind everyone, first of all, if you are here to make public comment at the end, anyone, there is a sign-up sheet over here at the end of this table. And for recording purposes, we need anyone that is going to speak to sit here, and we can move other chairs around if it's more than one person. I know this isn't probably any of our very most favorite room to be in, but it's a good one, and it is being broadcast, which helps those who cannot be here, particularly for some of the constituencies that you and we all work with. So we'll get started, and first of all, we have the Office of the Child Advocate. So I'd ask you to come up, introduce yourself to the committee, and share with us.
Chairwoman Dempsey, members of the committee, I'm Tom Rawlins. I'm from Sandersville, and as of last week, I am the new child advocate for the state of Georgia. I want to introduce myself to some of you and reintroduce myself to others. Of course, I was in this position from 2007 through 2010 under Governor Perdue. And then, as some of you know, I moved with my family to Guatemala to work on child sexual abuse issues for a few years. So it is with a real sense of feeling very privileged and quite frankly very happy to be back in this position. As most of you know, our office serves as the ombudsman for child welfare issues in the state. We work very closely with my dear friend Bobby Cagle to make sure that the work that they are doing is as effective and as efficient as possible for the maltreated children of the state. We, of course, respond to complaints, but we also view ourselves as a repository of information and education for both the governor's office and for you as legislators. So any issues that come up, questions regarding child welfare policy, regarding all of the various issues that touch children, children's mental health, juvenile justice, situations involving children who have issues that are come up either in foster care or in the home or in the school setting, we're here to help you. As far as our budget is concerned, it's a fairly simple amendment. It's $613. I hope that'll be fine. As I said, I've had the opportunity to work closely with my predecessor, Ashley Wilcott, who left the position at the end of last year. She's a dear friend of mine, and I was very proud of the work that she did personally, and I hope to continue that work over the next 3 years. Ryan Sanford of my office is here with me, and he'll be staying for the duration of the committee hearing, in part to support Bobby's request for DFACs. But I'm happy to answer any questions y'all might have.
Are there any questions from the committee?
Right.
Thank you. Thank you for coming back home and
Thank
for
you.
going to work.
I'm really glad to be back,
Thank
especially
you.
this time of year. It's my
Right.
favorite time.
Great.
Thank you.
Anything we can do for you. Okay, so next up, Georgia Vocational Rehab Agency.
Madam Chair, Committee, good afternoon. Thank you for the opportunity to be here today. I am going to keep this brief. Real quickly, I am the new Executive Director, Sean Casey. I've been on board for about two and a half months. The reason I find myself sitting here before you today is in 2012, legislation was passed that created the Georgia Vocational Rehabilitation Agency, and I helped spearhead that effort in 2012. One of the proud facts during that time was the creation of the 9-member board. And when the old executive director, Greg Schmieg, was leaving, the board remembered working with me back in 2012, made a recommendation to the governor's office. My wife said yes, so I said yes, and now I'm sitting before you today. In regards, and I will keep this brief and respect everyone's time, with the amendment, our budget is almost flat. It's an increase of $7,904. Overall, our budget is just a hair over $204 million. And I can go through this line by line, or I'd be happy to answer any questions that anyone has.
Are there any questions from the committee? particularly? You want to take a minute and look?
What page are you on, please?
Are you,
It is page,
the-
give me 1 second. I believe it is page 43 of 78.
that may be different. Let's see. You
Oh, I
know,
don't have that book on me.
do we have it on?
Or 128, I'm sorry. Thank you.
It's also, I think there's some on the information that,
Yep, and I can go
Leah
through this.
handed page
Would you like me to go
5.
through this?
on our information,
It's on page 5.
of our,
that
of our
packet.
little sheet. Go to your point. So the addition, just for the committee's purpose, the 7,000
Right.
plus dollars, where does that fall in, basically?
Correct. It's in 3 different areas.
Mhm.
Let me get specifics. It is an increase of $94
Mhm.
within our Business Enterprise Program. The Business Enterprise Program, just so we're all on the same page, helps train blind individuals to independently operate food service enterprises across the state. The total amount allocated is just a hair over $286,000. It is, again, an increase of $94, which brings the total budget to the BEP program, the Blind Enterprise Program, to $3.2 million. The second area out of 3 we saw an increase was the admin, which is $3,552. And the third and final increase was $4,258 in our vocational rehabilitation program. And with this total state funds, and let me just briefly
Right.
talk about the VR program, is $19,827,019. And when you add in the federal drawdown funds, the total funds is $102,098,982. And that is to assist us throughout our 40 offices located throughout the entire state.
Well, I don't see anybody punching their button. Is there any questions at all? You've got one. Representative
Yeah.
Kirby.
Non-budget related, are you gonna be hanging around to the end of this? I need to have a non-budget conversation with you and the other departments.
I will,
real
yes,
quick.
I will make the time, yes.
All right, thank you.
Great. Well, thank you. Thank you for the
Thank you,
work
everyone,
you're
for your time.
doing. And I believe now we're also going to hear from Warm Springs, a presentation, because some questions came up at our,
Yes, and actually,
Please.
you know what? I do apologize. I was supposed to do a very nice introduction for
We'll let
David
you do
Moore,
that.
who is the CEO of the Augusta University Health Roosevelt Warm Springs Rehabilitation and Specialty Hospital. And that is a mouthful.
it is, it is. Thank you.
Thank you, Sean. Thank you. I think everyone should have a packet in their PowerPoint presentation. And what I thought I would do is just briefly go through it. I know some committee members are probably fairly knowledgeable about Warm Springs and others may not be. So if I go too high, just let me know and I can dive a little deeper. What I thought, see the agenda, thought I'd give just a tiny bit of history, but I'll go over that very quickly. But on slide number 4, you see we go way back and certainly mirror Sean's agency in terms of Roosevelt coming to the campus in 1927, March of Dimes, 1938, and then really start to be that hospital and the vocational rehab in the 1960s. As you go to the next slide, the hospital complex and land conveyed to the state of Georgia. 1980s, the name came into being, the Roosevelt Warm Spring Institute. And then really modern history, in July of 2014 is when Augusta University came onto the campus at the request of the state and GVRA to come and look at the program. It was having financial difficulties, I think, for a number of years, and they requested the Augusta University to come in and evaluate the situation and see if they wanted to, if they could help. We were there for a year, did some evaluation, due diligence, and then in July of 2014, the property was conveyed over to the Board of Regents, and then the hospital was turned into a 501c3 corporation to actually run the hospital, and that's what I run. As part of that program, and I'll get into a little bit of detail in other slides, but as one of the kind of the biggest things we had to accomplish is renovating the facilities. The facilities, as folks who have been there, were in great need of repair, and the buildings that we're in date back to the 1930s. And some work had been done, but they really weren't up to modern day hospital standards. In fact, a good portion of the buildings were closed, had some offices, my office, but really weren't suitable to patient care. So what we started almost immediately is working to renovate those facilities. And actually the first one, open house, is Tuesday of next week, and then we'll be opening it for patients about 3 weeks later. And then the second phase, or a couple phases actually, but the final phase will open up in September, October of this year, 2017, and that will complete the renovations. On the next page, for folks who are familiar with the campus, you just see campus is very large, that Sean oversees, 900 acres. It's a lot of space, a lot of trees, but a lot of space, and quite a few buildings. The white areas are the parts that the Board of Regents actually oversees and the hospitals occupy. So you see it's a small part, but about 22 acres and a number of buildings, 123,000 square feet. Next page, just a little bit about the hospital. Like I said, we started in July 1st of 2014, being run and overseen by Augusta University Health System. We're a 501c3 tax-exempt not-profit corporation. We changed our name just so we could differentiate ourselves from GVRA, but also there's another hospital in town, a critical care access hospital. So they're also called Warm Springs. So we are different, and actually patients and others get us mixed up. But we are distinctly different types of hospitals. Of course, we share the campus with GVRA, and it's really been a really nice relationship. We buy services from GVRA. They have the cafeteria, they run it, and we buy food, for our patients and our visitors and our employees. We buy security and buy other things from them. So we actually pay on a monthly basis for our share of the campus, and I think that's worked out very, very nicely. Like I said, state-owned property. We own, the Board of Regents actually owns, but I run the 22 acres in the buildings, private ownership. We own the hospital license in that cooperative arrangement with Augusta University. So we share services with GVRA, but we also rely on Augusta University Health for a lot of the higher level, whether it's financial, audit, or other services that they can provide, certainly in a much more cost-effective basis than we could ever provide on our own, and that's worked out beautifully. And just a mission that's we really have enhanced with the Augusta University. We've been able to enhance our teaching programs, which I think, and I think everyone, certainly university, feels strongly about, that we're bringing a lot more providers or students, I should say, but to the campus. So they're coming into a rural environment as opposed to being in Augusta or Columbus or Albany or even Atlanta. They actually come to Warm Springs, and you can see the list of different providers, physicians, assistants, physical therapists. It goes on, and we're continuing to add to that so that we can bring these students to a rural campus and hopefully entice them to stay somewhere in Georgia in a rural environment. And that's actually worked out. I think the students have loved it, and we have too. Next page, for the folks who don't know, and I won't go through the detail, but just to show you a little bit, we're a post-acute care provider. So we're not like a Grady or an Emory, certainly a size not wise, but we're a post-acute provider. So patients who need our services after they stay in a acute care hospital, they would come to us. Not a nursing home, but not a large acute care hospital. A long-term acute care hospital, and you can kind of see the definition there, and then an inpatient rehab hospital, and you can see the definition there. 2 separate licenses, so 2 separate hospitals. just talk about the renovation. A big part of the transfer was the need for the renovation, and as part of the negotiations for that transfer, state bonds were issued for $26 million, and that was what we identified as our immediate needs for renovation. I listed out some of the things, just a new entrance, new lobby. We had additional beds. Really, the facility was too small to have the economies of scale you needed. So we are enlarging the facility. Procedure rooms. IT is just 2 letters, but that was really a large chunk of the bond issue was to support a new information system. And that's just a very expensive part of what we do, but certainly very necessary part of what we do. High observation unit, new C-arm. We really replaced or in the process of replacing almost everything from beds to monitors to defibrillators, you name it, we're almost replacing it. So all in need of that. Certainly, maybe the most important slide, just to show you kind of the progression over the years. In the year ending 6/30/14, which was the final year, the state was running the facilities. State appropriations were 6.4, as you can see the number, $87 million. In the first year of operations, we did receive a subsidy of $3.4 million, and we showed a net income, and I'll have to come back to that, of $554,000. And then year ending 6/16, we had a state subsidy of $2 million with a loss, and then year to date, so 6 months. That's only 6 months. We've seen $800,000 subsidy, and we're seeing a $56,000 profit year to date. Now, it's kind of a little bit confusing, but I did footnote it to hopefully help clarify it. In 2016, through auditing the books, through Medicare and our own audits, discovered problems that Medicare picked up on, who is our primary insurer, and also our own internal audits that were for past due monies. So when we had to recognize the losses in the year we discovered them, even though there were losses back in 2012, 2013, which are owed to the federal government, and some state monies are there too, and we have to pay them back. That's just the law. But we had to recognize them in the year that we realized them. So that's the 3.2. And that actually goes back in some into 2015. So, we did experience a loss in 2015. It wasn't huge. And then in 2016, we would have experienced a loss also, but nowhere near the 3.2. And then it looks like in 2016 at 56,000, that's probably, unless we find anything else, which we don't anticipate at all, it looks like we're certainly doing a lot better. The year subsidy for 2016 is a $1.6 million, which is what is in the budget for 2017. Now, maybe at the end, ask any questions about that. I know it can be kind of confusing, but just the next part, I'd like to show you that we're very proud of what we're doing to the campus. We've been able to, I think, use the $26 million very wisely. And the first page is really the kind of a new entrance. The hospital really never had its own identity or own entrance where patients or ambulances would come. So we've kind of carved out a space, and I think really made the whole front look better when it's all complete. Right now, it's still kind of torn up. And then the entrance to the hospitals will be on the side of the building, which was a courtyard, but I think it's going to look, we tried to blend the old with the new, so it looks new, but it does blend in with the architecture of the building. Like I said, that building dates back to the 1930s. And that's just a few quick snapshots, and then just some of our marketing materials just talks a little bit about what we do in the Warm Springs area. Very high level, but I did want to answer any questions you may have.
Representative Oliver.
Thank you. This is very helpful. I've been trying to remember the past several years of budget discussions. You have about a 60-bed capacity. How many beds are filled today?
Right now, today we have a census of 36.
Okay. And as your renovations complete, obviously you anticipate being full, or where are your patients coming from?
They come from all over. We're fairly unique. I've been in this business for 30 years, and usually it's just your immediate facility around you. Mm-hmm. But being in Warm Springs, it's we don't have that many patients that would come from our area, even though anybody that lives in that area clearly wants to come back, and they can be in another state, and they'll say, we want to go back to Warm Springs. I would say Muskogee County, Pike, Troop, Harris, that's probably 50, 60%, 65% of our patients. But Atlanta, there's quite a few patients come down from Atlanta, and now with Augusta, we are getting a growing volume, not huge, but it's certainly something that didn't exist before.
When you use the term ventilator management, primarily critical care patients, that to me connotes long-term, but your average stay is shorter. So
Yeah. Great question. We're not a that name is in the long-term acute care, but long-term meaning 25 days. We have patients that can stay 100 days, but that would be highly unusual. I say that, and then we do have a patient that's been there 100 days now, but usually 25, 30 days, 40 days is what we normally see. Of course, the patient can leave in 10, but that's the norm.
Final question, Madam Chair. Historically, we had some discussion about the hospital being used or by military personnel. Has that developed in any way?
Not in terms of patients, not yet. We'd love to form some kind of affiliation, but really haven't gotten to that point yet. We did Fort Benning or even Fort Gordon. I know and I'm not an expert. I've only been Scott Johnson, I think, with the Warrior Alliance. I know they've got some pretty big plans for the Warm Spring campus and the golf course. So I know that's coming up very soon, and they've got a lot of energy behind it.
But that's not the part that you own.
Correct. That's separate, actually.
And when you say your hospital license is private business ownership, what does that mean?
We're a 501c3.
Okay, it's not separate from your 501(c)(3).
No. That's the same thing, like most hospitals in Georgia.
Okay, so there's nothing equivalent to this in the state hospital system. You're pretty unique.
Well, in the state of Georgia, there's quite a few 501c3s. I would say the vast majority of hospitals in general are 501c3s.
But not owned by the Board of Regents.
No, we're only one, yes.
Yeah, that's what I thought.
Yeah.
Okay.
Any other questions? Well, thank you for that update. I'll tell you, some of the committee visited several years ago, and we're going to try our best to work out a time after session to come see it, because it is hard to grasp how big it is, and I certainly want to see the renovations. The last time I was there was before y'all had created this wonderful partnership, so I want to go see it again myself. So
In September, we'll have the grand reopening. I'll make sure everyone gets an invite. It should be really very nice.
Great. Well, thank you for the work you're doing, and for also saving some very important historical structures. That's really important. Thank you.
Thank you.
We are moving along pretty quick. I'm thinking that what we did last week helped everyone, actually. Okay, so next, the Department of Department of Veteran Services. Up next, if y'all will just, and if we need to pull some more chairs around, please do. And that's on page 6 of your information. If you. What did I do with it? Did I eat it? I've got it. I think. Got it.
Good afternoon, Madam Chairman and members of the House Appropriations Human Resource Committee. I'm Mike Roby, Commissioner of the Veteran Service for the state of Georgia. It's a pleasure for us to be with you today to discuss the Governor's recommendation for the amended FY 2017 budget for the Georgia Department of Veteran Service. With me today, on my right, is Assistant Commissioner for Administration, Health and Memorials, Mr. Dan Holtz. Behind me is Mr. George Canavaggio, Assistant Commissioner for the Field Operations and Appeals. Our Operations Director, Mr. Mark Bannister. And over to our right, the lady that keeps us all squared away, is our Budget Analyst, Miss April Dodgen. First, I want to mention, we brought with us today responses to the several questions from the members of this committee presented during our appearance before you on the 3rd of January. They are on the left side of your folder, and on the right side of the folder is today's presentation. Our presentation is based on the governor's amended fiscal year 2017 budget found on pages 208 through 210 of the governor's report. We are pleased with and support the governor's recommendations for the amended FY17 budget. As you all are aware from the governor's State of the State address yesterday, along with his other priorities for the state, the services and sacrifices of our veterans is a major priority for this administration during this legislative session. Our staff is ready to do its part to continue to support our nation's veterans. Your support through the amended and the operating budgets will make all of this happen. On page 2 of our presentation, we have provided a department summary of the current FY 2017 budget and the changes proposed by the governor and the amended FY 2017 recommendation. The governor's recommended changes for the amended budget for our department total an estimation increase of $91,601. The amended state general funds will increase to $21,454,947. There are no projected changes to the federal and other portions of our budget, which total $17,839,989. This brings our total funding from all sources to $39,294,935. As a quick reminder, in the federal FY15, the VA paid to the veterans of Georgia over $3.1 billion in compensation and pension claims benefits. These benefits are tax-free to the veterans, and the money is spent by them in Georgia to purchase goods and services and to pay state and local taxes for sales, properties, etc. According to the Atlanta VA Regional Office, 68% of those claims payments of $2.1 billion were handled by the Georgia Department of Veterans Service. In addition, the VA paid approximately $5.8 million in education and vocational rehabilitation / employment benefits in Georgia. Again, this is tax-free money. The first 3 physical programs for the Georgia Department of Veterans Service are depicted on page 3 of our briefing slides. The only changes reflected in the administration, cemetery, and nursing homes physical programs are related to the statewide adjustments to the merit system assessments. Page 4 depicts the recommended changes for the Veterans Benefits Physical Program, which totaled an increased funding of $91,895. The first change is a statewide adjustment to the merit system amounting to a decrease of $755. The second change is a request for increased funds to support the replacement of 25% of our information technology hardware. Most of our department's IT hardware is made up of personal computers and laptop computers. Each of our veterans field service officers have personal computers for each of the field service offices. In those 25 offices that provide itinerant service to nearby satellite offices we have around the state, we also have laptop computers that are used to support office hours at those satellite locations. We have embarked on a replacement and upgrade schedule for these equipment items over a 4-year cycle to ensure the hardware continues to meet current technology requirements for entering data, transmitting it, accessing it, and monitoring it through the U.S. Department of Veterans Affairs portals and websites to better assist Georgia's veterans. We have requested $67,650 to replace and upgrade our IT hardware that equates to 25% of our total inventory. The third change is a request in the amount of $25,000 to provide a one-time funds to to purchase one motor vehicle to support the department's activities in the field. We currently have one vehicle, a minivan, which is 10 years old. It is used to support department personnel travel across the state, administrative trips from the central office and the Veterans Memorial Building across the street from the Capitol to our appeals division located at the Atlanta VA Regional Office in Decatur. In addition, senior department staff use the existing vehicle to travel across the state to visit field offices, our nursing homes, our veteran cemeteries, and to support the Certificate of Honor PIN program related to the commemoration of the 50th anniversary of the Vietnam War. Having only one motor vehicle makes business travel across the state a major scheduling process to ensure all the supported activities and items are accompanied. The existing minivan is presently in good shape. However, we need to have a second motor vehicle to meet our mission requirements. We looked at a lease option for the second motor vehicle. However, in conjunction with the governor's OPB, we determined the purchase of one vehicle was the better option. Madam Chairman, this concludes our briefing, and we'll take any questions.
Well, thank you for giving
you,
us some
ma'am.
more information. So the vehicle that you want is a regular passenger car, is that right? Or is it a van, or?
Ma'am, we are open. We would like to have either a minivan or a small SUV.
Mm-hmm.
Yes,
Okay.
ma'am.
Okay, well, great. Okay, so I do see Representative Benton, I believe.
Yes, sir. Yes, ma'am.
About the vehicle,
Yes, sir.
have y'all looked at just paying mileage for your employees to go from one place to another instead of buying the vehicle?
We did, sir.
Okay, would that cost be prohibitive?
It would be more, sir. We looked at it. If we use the employees in the field, not only the senior staff, but some of our supervisors in the field, it would cost us more money to.
Well, are you
For
already
mileage.
doing that?
Yes, sir,
Because
we are.
Because one vehicle, and you got all these field officers.
Yes, sir.
Okay,
We're
thank you.
paying mileage, yes, sir.
Huh?
We're currently paying mileage.
Okay, thank you, ma'am.
Do you have any idea how much that approximately that comes out to be, that mileage?
We'll get that figure to you.
We can get it
Yeah,
to you.
that'd be
Yes, ma'am.
good, just for us to know. Okay, are there any other questions here among the members?
Ma'am.
Yes, Representative Oliver.
Some agencies use the state's rental car. They have an enterprise system. Do y'all use that also?
We have, yes, ma'am.
Okay. I think I was the one that asked the question that's set out in your enclosure about if you've done any kind of work study analysis about your benefits office. And as I look at the attachments you've given me, correct me if I'm wrong here,
Okay.
what you're doing is, again, stating the overall veterans population for an area office. You're not stating the number of people who actually come in and ask for benefit services. Am I misreading this? Am I wrong about that?
The offices that we're looking to add, we don't have the data that would say, you know, someone who is living in McDonough, where they're going. Or
Mhm.
if they go to the Atlanta office, or they go to the Griffin office, or
Mhm.
wherever. We don't track that data.
Mm-hmm.
And so what we have been tracking is the population that is in those areas. We do have data as to how many people are being seen
Right.
by the Griffin office or the Fort McPherson or downtown Atlanta. I mean, we can get you those data, but we can't break those out and say that, you know, this many of them were from McDonough or Fayetteville or those kinds of things.
When I'm really trying to analyze this in terms of looking at other agencies. How, and they don't say the general population of poor children is 2 million. They say this office served 100 children and we had a caseload limit per benefits officer of X, and the time served was Y, and we created a benefit of Z. I've seen that analysis in veterans clinics that are throughout the state, and I'm sure the federal offices do that kind of analysis.
We can get you those data for the offices that we have.
That we serve.
Okay? But what we're proposing, in our request that we submitted to OPB.
For
was-
18, excuse me, Madam Chair, this is
Yeah.
18 stuff.
Right.
Yeah, but we were proposing was to, there's a population out there with an unmet need.
You say that, but you're basing that based on the overall population
Correct.
figure, not in terms of the number of people that are
And
coming to
again, we
your
don't-
office.
We don't track that particular thing.
And you don't compare it to the number of people coming to federal benefits office either. So where's the greatest need of people standing in line? And what are the caseload? That's the kind of thing that I'm used to seeing, and
Yeah.
I'm not sure whether y'all track it that way or not.
Well, we can get you the data on the offices that we have that are in this area where we've asked, put the request in.
Thank you, Madam Chair.
Okay. Any other questions, Representative Kirby?
Yeah, I'm looking at table 1, and I appreciate you getting all this information. I want to make sure I'm reading this right, and I guess this is dealing more with the feds. Your Veterans Field Service Officer, VSO-1, in Georgia, annual salary 27,160, and in the job description under the feds, high school diploma with no experience dealing with veteran benefits, and they're paying them $42,000 to $55,000 a year.
That's correct.
Yes, sir.
Okay. Thank you.
Bit of a surprise to us too, when we started asking. the
I mean, this
questions,
is just
that's what
somebody
they came
graduated
back
high
with.
school and has never done this stuff before, and you can walk in with that kind of starting pay
Federal
range.
VA.
With that kind of starting pay, yes, sir.
Representative Taylor.
So, following up on Representative Kirby's question, the turnover that's going to cause, you basically train people in that process and then lose them to a higher paying,
Correct.
position. I guess what would the average length of service be if somebody coming in new to your organization?
Sir, with the VA, it's averaging about a year. We get them in the
Okay.
appeals division, get them trained up. The VA has their eye on them, and as I mentioned last week, we're paying them $28,000. VA will come up and say, "We're going to start you at $58,000."
Okay. So you would say the average roughly is
Yes,
is
sir.
a year? Okay.
About a year.
Okay, thank you.
Yes, sir. That's
Any other
July.
questions? Anyone? Any follow-up? Okay, well, thank you.
Thank you,
you so
Madam
much
Chair.
for coming back
Thank
and
you,
for
ma'am.
clarifying. And as you said, there are responses written in our folders about
Yes,
some of the
ma'am.
questions
Yes,
for
ma'am. That
us to
Representative had.
look at,
And we'll get
talk more.
And we'll follow
we're
up
up
with some
on
more.
with
Thank you.
Representative Robbie.
Thank you.
Thank you, ma'am, for your time. Board members,
Thank you.
thank you, Bubba.
Okay, so I believe next, we have the Georgia Department of Human Services. And page 3 on your information will break out their requests. They are so excited, aren't they? If they only knew what we were talking about, they'd be really excited up here. Great. Commissioner, whenever you're ready.
Okay, thank you. Good afternoon, Madam Chair and members of the committee. Thank you for asking us to come today before you to discuss the governor's amended budget proposal for fiscal year 2017 for the Department of Human Services. My name's Robin Crittenden, and I have with me today members of my leadership team, Aging Services Director Abby Cox, Child Support Services Director Tangela Gray, Deputy Commissioners Gerald Hines and Renorta Hurd, Demetrius Taylor, Director of our Office of Budget Administration, and Ashley Fielding, who's the Director of Legislative Affairs and Communications. Additionally, I'm joined up here by Bobby Cagle, Director of our Division of Family and Children's Services, and he's here today with his leadership team to present the details of the DFACS proposal. We're going to be speaking today from the presentation that is on the left side of your folders, and you'll see that the DHS fact book, which was recently emailed to all of you, is on the right side. These first couple of slides, we covered quite a bit of this when we met last week, so I'll go through it quickly with you. So I'm right on page 2, starting on page 2 right now. Our vision in the Department of Human Services is to build stronger families for a stronger Georgia, and each policy, program, and service is judged by that criteria. Does this help build stronger families, and as a result, a stronger Georgia? I'm going to provide you with a little background on the divisions of aging services and child support services so you may better understand the impact of the governor's proposed amended fiscal year 2017 budget. Aging services serves older adults, adults with disabilities, and their caregivers. First, the division works to ensure these vulnerable populations are protected from abuse, neglect, and exploitation through adult protective services. Additionally, through our aging network, the division provides several support services that help adults maintain their independence and remain in the setting of their choosing. These services include home-delivered meals, legal assistance, and Medicare counseling. Child support services seeks to enhance the well-being of children through the administration of financial and medical support. While the typical administration of child support includes the establishment and enforcement of support orders, child support services in Georgia is also nationally recognized for its efforts to support parents in their efforts to support their children, reducing incarceration rates, and helping underemployed and unemployed parents obtain job training so they can better meet their obligations. One of the major issues that we are looking at in aging services is hunger in our state. Georgia ranks near the bottom for senior food security in the country. We know a large part of that issue is due to food access. As of the close of state fiscal year 16, approximately 3,700 people were on the wait list for home-delivered meals, and our data tells us that those who are placed on the wait list are usually on there for a year. So we knew this was an issue we needed to begin to wrap our arms around as a state. In September, we hosted our first Senior Hunger Summit, bringing together experts and policymakers to start a discussion that will get us closer to a solution for this issue in our state. We are now working on our first state plan to address senior hunger, so I hope that when you see me again next year that I'll be here talking to you about potential solutions for that issue. The governor and the General Assembly have been very supportive of efforts to allow disabled adults and older Georgians to remain in the setting of their choosing, providing support to the home and community-based services program. Past support has helped Georgians delay nursing facility placement for as many as 51 months. With the additional support provided in the FY17 budget of more than $2 million, we have set a goal to extend that period to 56 months. In the Division of Child Support Services, we've continued to exceed performance goals set by our federal partners. In fiscal year 2017, we exceeded the goal to establish paternity on 90% of cases by nearly 4 percentage points. We exceeded the goal to collect 65% of child support arrears by half a percentage point, and we exceeded the standards for data efficiency and reliability in an audit of 2015 data. Child Support also launched 2 services to provide our customers with better access to us, a mobile app and an online chat feature. This fiscal year, our goals for child support are to continue exceeding federal standards and to increase enrollment in programs that help parents who are unable to pay their support attain jobs paying above minimum wage so they can meet their obligations. One of the ways we do this is through hosting events around the state called Fatherhood, a Celebration. These events celebrate the roles that fathers play in the lives of their children. The events provide a fun atmosphere for parents to spend time with their children and to learn about the unique resources available to parents struggling to pay their child support. We had a very successful event in Atlanta back in June, and we'll be hosting more in Augusta, Macon, Columbus, and Valdosta this year. These locations were determined based on data that showed where we had both the greatest number of non-paying parents and the least number of participants in our programs. So to accomplish all of these goals and continue all of these initiatives, DHS has about a $1.6 billion budget allocated to protect and serve Georgia's vulnerable populations. Accounting for DHS and its attached agencies, the total FY17 budget allocation is $1.78 billion. Now let's take a look at the governor's amended 2017 recommendation. If you are following in the governor's budget book, DHS starts at page 124. One new allocation in the amended FY17 budget is additional funding for the state's new integrated eligibility system, also called Georgia Gateway. This is the largest IT project in Georgia's history, updating many antiquated systems supporting economic assistance programs that are administered across all state agencies, including the Department of Public Health, the Department of Community Health, and the Department of Early Care and Learning, and making the processes associated with these programs more efficient. We will pilot the program for most programs in Henry County starting on February 6th. Right from the Start Medicaid and Peach Care for Kids will also go statewide in February. Our intention here is to make sure we have the system absolutely ready to roll out to all counties. Henry County is a good place for us to go to pilot because the cases managed out of Henry are very similar to what we deal with statewide. While the pilot is technically in Henry County, you may have constituents elsewhere in the state who are part of our pilot program, because Right from the Start Medicaid and Peach Care for Kids will go live statewide if someone is on one of these programs in a county outside of Henry and is also on food stamps or WIC. They too will be part of the pilot group. So that we can ensure a successful implementation of the program throughout the year, the governor is recommending adding $13.5 million to departmental administration in the amended budget for FY17. Additionally, to support our ongoing efforts to prepare the state for the silver tsunami and to better serve the growing population of Georgians, the governor is requesting that $185,842 be moved from the departmental administration to the Elder Community Living Services budget for the Alzheimer's Diseases Supportive Services Program grant. This provides matching funds for a federal grant that allows us to further develop Georgia's dementia-related systems and services. This would be a one-time expenditure that's split between amended 2017 and fiscal year 2018. And finally, the governor is requesting that $93,205 be moved from departmental administration to the Elder Abuse Investigations and Prevention Program budget to fund a one-time position in our to fund a full-time position in our Forensic Special Initiatives Unit. This position would increase our ability to build the network of law enforcement, financial institutions, and personal care homes that are integral to ensuring vulnerable adults are protected from abuse, neglect, and exploitation. So that concludes the governor's recommendation for the amendments to the FY17 budget for DHS. As you know, DFAC's director, Bobby Cagle, and I have worked very closely together over the last year and a half. In my time with DHS, I've watched Director Cagle lead a reform effort in DFACS called the Blueprint for Change, and I have seen firsthand the benefits of this effort, and am pleased to be working with him to expand the blueprint to the entire agency. At this time, I'm going to ask that DFACS Director Cagle present the governor's recommendation for that division's amended budget.
Thank you very much, Commissioner Crittenden. Good afternoon, Madam Chair, members of the committee. Thank you very much for the opportunity to be here with you today. We're on page 13. I think I've probably just about covered the blueprint for change with everyone in here at least 5 times. So I'll just hurry through that. Of course, we've been focused for the last 2.5 years on making sure that we have an adequate workforce to do the work that we need to do. We have increased staffing. We are increasing the expertise. Now we're beginning to work on the retention of the employees that we have. We're also working diligently to institute a practice model for our department, and we're adopting a research-based model called solution-based casework that is consistent with all of the principles that Commissioner Crittenden stated earlier. It also is something that I think is going to revolutionize the culture of the Division of Family and Children's Service, something that needs to be done. It is in training process right now. It's a 28-month training process combined with a certification process for each and every caseworker that we have. At this point in time, we have completed about 50% of the training that we need to do. And between now and April of 2018, we'll complete that training and complete the certification that is needed. Part of what we have done is to engage constituents throughout the state. I've traveled over the last 2 years to every region of the state and have talked with as many legislators as possible, as well as many of your constituents as possible, to better understand what the needs in communities are, better understand how we can work with communities as opposed to working at odds with communities. And I think we are achieving that goal and improving on it every day. I will refer you to page 14 in our presentation where we talk about the Division of Family and Children's Services caseloads. This is the caseloads only for child welfare, and we're running at about 19 per caseworker if we have all positions filled. I think yesterday in the governor's State of the State address, he addressed the issue of turnover that we have. We fluctuate on a monthly basis between 32 and 37% annualized turnover. So I'm looking forward to the future discussion of the FY18 budget. We also track these same statistics for our economic services programs, and the standard that we're shooting for there is about 450 cases per caseworker. At this point in time, we're handling about 800 cases per caseworker, but we're doing so in a very efficient fashion and have continued to improve. I think I shared with you when we met on January 3rd that we have improved our timeliness and completion of eligibility determinations from 66% in 2014 to 97 to 98% at this point in time in our SNAP program. So I'm very pleased to tell you that we're improving in all areas in our eligibility determination. I'm going to skip forward, if it's okay, Madam Chair, to page 18 to cover the only large item in DFAC's budget that will be changing. You'll see reflected throughout your budget documents a number of the merit system changes that are statewide. I won't touch on those, but the primary change in this amended fiscal year 17 budget is in our out-of-home care. This is the per diem payments that we make for those kids who are in foster care. This is a reflection of the 15.7% growth in that population that we have seen over the last year. That's been a consistent growth factor for us. In the last couple of months, I watched this actually on a weekly basis. In the last couple of months, we've actually seen a small decline, which has gotten my hopes up that we may be seeing a leveling off of that, but I will keep you updated as we see further data. In this, this is a $28.61 million addition to our budget for FY17, and that is the figure that we project will be needed just to maintain the care for the kids that we currently have in foster care and those that will come into our care between now and June 30th of this year. I'm very pleased to answer any questions that you might have along with Commissioner Crittenden.
Representative Henson. Is it, or is it?
Thank you very much, and thank you for everything you've been doing. I mean, it's been remarkable. You said something about caseworkers and 450?
That's in our eligibility services area. That's the standard that we're working toward. Currently, they are carrying on average 800 cases per caseworker, and doing a very admirable job even at that.
That's per year.
No, that is at any given time.
So when someone deals with eligibility, they're making sure they're eligible, they process them, and then it moves on, and it would be someone else who would pick it up at that point to work with the individual if they need anything. The eligibility just deals with signing them up. Is that all?
Actually, we have changed our model over the last 2.5 years to something we call one caseworker, one family. When I came aboard, we had changed to a system called Georgia One, which was intended to be a call center based operation that would allow people to do all transactions by telephone. When I came aboard, as you heard earlier, we were in pretty dismal shape with regard to how quickly we got the work done. I also heard roundly from members of the legislature as well as from individuals from all over the state that system was not working. The almost uniform request was that we move back to a system where we have individuals in county offices who see people in person, and then augment that with the opportunity for people to handle eligibility by telephone if they so desire. We have completed that transformation. The process that is intended is that one person actually be the person who takes the initial application, makes the eligibility determination, and carries that case from that point forward in order to be able to allow them to develop a knowledge of the person that they're working with and their family, as well as to be able to maintain some consistency for the client.
Okay. It just sounds like a lot of people, I know what they're dealing with right now is
It is
double what you want them to.
It is a lot.
Yes. Okay, thank you for your explanation.
Absolutely. I should say that there's about 1.8 million Georgians that have some sort of economic services benefit in the state each and every year.
Have some sort of what?
Economic services benefit.
Okay.
That could be SNAP or food stamps.
Yeah.
It could be Medicaid. It could be TANF, or it could be child care.
Okay, thank you.
You're welcome.
Representative Benton.
Thank you, Madam Chair. I had a couple of questions, if I could, please, ma'am. The first one was you mentioned a waiting list for the Meals on Wheels. What would it cost to get those people off that list?
The entire 3,700?
Mm-hmm.
We'll have to, can we get back to you with that figure?
Mm-hmm. I'd just like to know what it costs to get everybody
Absolutely.
off the list
Okay.
one time.
That's, okay.
Second question is, deals with the additional money that is being asked for children placed in foster care. Is there, and I seem to remember that we helped out with this last year. Is there any recommendation to help with the kindred care? We have a lot of grandparents and aunts and uncles that are looking after the children of either their grandparents looking after the kids of their children, or aunts and uncles looking after their children of their brother or sister. And it seems like that we're willing to do a certain amount for people who will say they will be foster parents, but we don't do anywhere near that for people who are related to these children that will take them in. And can you tell me why we don't raise that up so that maybe more relatives will take these children?
Absolutely. So it is our desire, if children come into foster care, I think our first look needs to be, is there a family member who can take that
Yes,
child?
you've told us that, and I agree with that wholeheartedly. Go ahead.
Absolutely. I think back to my own situation growing up. I cannot imagine having to think that I would have gone to a stranger's house when I had aunts and uncles that lived all around me. And we know that it's less dramatic to the kids, and that's exactly what we want to do. In the circumstances where the people come aboard and become foster parents, we do pay them the same foster parent per diem that we would afford any other foster parent. In situations where they don't want to become foster parents but do step forward to care for the children that are in our custody, we pay them 80% of the foster care per diem. The purpose behind that is that we've been wanting to encourage more to become foster parents. It also assists us with the amount of reimbursement we get from the federal government, because unless they're certified foster parents, they cannot be eligible for federal reimbursement. So we are working on those ends. We also have available to families that take children in without DFACs coming into contact with the family a couple of programs, one being Grandparents Raising Grandchildren, and the other being our TANF program, where we would provide a small supplement to their income in order to help them with those children.
Can I ask another question, ma'am? But if these people are willing to take these children, and you're giving them 80%, does that include insurance, clothing allowance, and all these other things that go along with being a foster parent?
It does. If they're in our custody, the children get the same benefit regardless of where they're placed.
But I don't mean to interrupt you, but if they're not in your custody, in other words, the grandparents have just taken the children, what happens to, how much is the reimbursement for that? Is it still 80%, or is it a lot less than that?
If they're not in our custody, it is considerably less under both Grandparents Raising Grandchildren and TANF.
Right. Is there a reason for that, or is it just that we're concerned that there are people that there are shysters out there all over the place that would say we're raising our grandkids and they're really not doing it, or they're
I think we're operating here on the premise that once the children have gone through the DFAC system, the court has placed them in our custody. Of course, we become the de facto parent for the children. I think your point is one that is well taken, that there are families all across the state that prevent children from coming into our care because they do step forward. I think that's an issue that the minority leader of the House has addressed in the last session. We have put into place some additional supports for those people, but I think it is still something that we need to examine more closely, because it certainly could be the case that we could have a lot more children in our custody if those people did not step forward.
I was on that study committee. I was astounded at the number of kids that are not in the system but are being raised by grandparents, and what a hardship it is on those grandparents to take those kids in, to keep them out of foster care. Okay, thank you, Madam Chair.
Representative Oliver.
Representative Benton has hit on something really important, and I have this small issue I've talked to you about that I think the bill number has a bill number today on closing at least one little gap for it's family rescues without state intervention.
Yes.
For low-income family members who are family rescuing, doing the right thing, that we need to support more. But let me ask you, this is a little bit of a history thing to bring myself up to date. Representative Welch and Representative Dempsey, and I can't remember exactly, were involved in a study effort to uniform evaluation and licensure and updates for providers, and that got a little bit controversial. Can you give me, since we're having so much more expenditures here and hopefully enough providers, what happened to all that effort to try to coordinate more efficiently the licensure oversight?
That actually was a joint effort between ourselves, the Department of Human Services, and the Department of Juvenile Justice. Commissioner, do you want to speak to that? I know, and I can assist you. I know that we don't have anything prepared on that, but we're glad to talk.
And I won't take time of the committee, but I just thought it's relevant
good.
to this.
It's real good.
Well,
Yes.
just briefly to bring you up to date, we have been moving forward with that effort, and so just several months ago, I think, can't remember exactly which one, but we actually signed a memorandum of agreement that was with DFACS, DJJ, as well as DHS, as to how we would go forward and who would do what. We are doing some joint reviews of different facilities and things, and we are working towards having the joint scorecard and having the website come up as well, so that there'll be that scoreboard. So that is going forward, and I believe the impact so far has been positive with it.
That's really good news. That's very good work, because helping these providers with this new workload is, thank you.
Any other questions from the members? Well, I know I've already shared with you, Director Cagle, but yesterday when the governor spoke, I had to kind of hold myself down in my seat, not get up and yell touchdown, right in front. That was some very good news, very worthwhile. And I'm excited that Georgia's in the place where we can continue to really try to help in a meaningful way, to encourage people to go into the field of taking care of Georgia's children and families that are in need, and elder care and every other thing that's in this room. I think we're on the precipice of some good work. I know there are a lot of huge hearts in here, and I think we can all work together and see, we're close to a time of harvest, I think, so that's what I would say. Yes, absolutely.
The proposed pay raise for the workers, on average, what's that gonna do to a worker's salary?
As the governor said, that's on average a 19% increase. We will have to apply that across our entire caseworker, supervisor, manager series in order to be able to keep the caseworkers from making more than supervisors who make more than managers. But on average, it will be about a 19% increase. We will bring the starting pay, which is around $28,000 a year right now for BSW, Bachelor's in Social Work. We'll raise that to around $36,000 a year.
That's great.
It's great. It will also incentivize and encourage people to begin to study in that area, which is a shortfall that we have in our state. So I think it's all working toward the greater good.
Yes, indeed. I have to tell you, I was overjoyed and almost couldn't sleep last night because it was such good news. So thank you very much.
That's going to put
you.
that will put more pressure on y'all now.
I shared with my leadership when I met with them last month in Macon. I knew what the proposal was going to be. I could not share it at the time, but I told them that we were about to have a proposal put forward that would be remarkable and really a major change for our division. But I then quoted for them the scripture that says, from those who great things are given, great things are expected. And that is the way I live my life, and that's the way I expect our division to live its life if we're given the resources.
Absolutely. Very good. Thank y'all.
Thank you.
Thank you. Okay, I want to remind you that if you wish to speak, if you would just sign up, and we'll begin to work through that process too. Okay, great. So we have a few people, and we'll start off first with Ron Scroggy, Together Georgia. Ron, if you just come join us up at this microphone, please.
Thank you, Madam Chairman and members, for allowing me to come before you today to speak. My name is Ron Scroggy again, and I'm the director of Together Georgia. Together Georgia is a trade association representing about 150 child, youth, and family service providers across the state. Some of you were at the Methodist Children's Home last month, and we'll hear some of what I had to talk. We'll be talking briefly about this afternoon. First of all and foremost, I want you to know that the provider community wholeheartedly supports the 19% salary increase for the DFACS staff. As a former state director of DFACS during the Great Recession, I know how dedicated and deserving these staff are. So it's long overdue, and I know they're going to be thrilled to have heard that news yesterday. Secondly, I want to discuss with you the need for the rate increase for private providers. Over the past 12 years, there's been a total of a 4.5% rate increase. Last year, this committee helped to push through a 1.5% of that 4.5%, and we're very grateful and thankful for your efforts in that part. One of the documents I share with you today is a report compiled by DFAC's Finance Director, Cliff O'Connor, a personal friend and a great colleague that I've known for many years. In this report, you can see that DFAC's own analysis is that on average, the private providers are paid 18% less than their cost of care. DFAC's own recommendations in this report was that the room and board and watch oversight providers should be given a 6.46% rate increase for each of the next 3 years, beginning fiscal year 18. This increase was not included in the governor's budget, and I'm hoping perhaps you could consider it as some offsets in the amended 17 budget that you're now considering. As you've heard, it is anticipated that there will be roughly 16,000 Georgia children served in out-of-home care in fiscal year 18. This compares to 8,000 roughly in the year 2013. Somewhere around 40% will be served in partnering private provider agencies. Those providers cannot continue to serve more and more children without a meaningful rate increase, and we hope you will consider that. The last thing that I would like to bring forward to the committee today, and it came out in the governor's budget yesterday, was the 50% foster care rate increase for basic DFACS foster homes. Again, private provider community strongly supports this and is long overdue. However, we strongly urge that the same increase of 57% be applied to basic care rates in the private foster homes. I was in conversation with folks, I was given a reason. The reason this was not applied to the private foster home, basic foster homes, was because many of the children that are served in private foster homes have waivers and they receive a higher rate. This morning I had a meeting with about 30 foster care agencies, and I asked that question, and somewhat to my surprise, some of them had actually 0% of the children that they're caring for did not have waivers, which met that reasoning or that logic. But up to several of the providers there, most of them, matter of fact, did have many children that were being served and did not have waivers, a couple of them in the 90 percentile. So in a day and era when we need desperately more foster homes to care for this growing need of out-of-home care, and we at the private provider community also totally support the need for kinship care, like you were mentioning earlier. And I know Governor Director Cagle has a goal by next year to have 50% of all children that are in out-of-home care to be in kinship care, a goal that we too support greatly. But still, that leaves 8,000 children roughly that are going to be in out-of-home care, and 40 to 50% of those in private homes. So we need to make sure we have a level playing field so that enough foster homes can be provided both in the private and the public sector. So I hope you'll consider perhaps that is another area that you consider in the FY amended budget augmenting. With that, those are my comments. Any questions?
Are there any questions from the committee? Yes, Representative Benton.
It might be more to you, Madam Chair, than to the gentleman here. Do you have any idea why the governor didn't add any? I mean, we struggled to find the 1.5% that we added to them last year to try to find it, to put it in there. Mm-hmm. And he's asking for 6 for the next 3 years, and we were barely able to find 1.5 last year. And I just wondered what kind of communications we need to make to see about getting this raised up. I don't know. And you're the guru of the committee, so I figured you would know that.
You know, it would appear at this point, the funds that are available to us in the 17 amended, that we may have to start really looking hard at 18 and try to get ahead of that a little bit if we can. But we'll continue.
Well, you know, I've sat in this chair 3 years in a row, and I've had this ask, and of those 3 years we got that 1.5%, or 2 years anyway. We, last 2 years and this year also, completely support and are applauding the efforts of the governor and Director Cagle and all his efforts and their efforts to get more resources put into DFACS and the care of both the caseworkers and the children. But we come alongside of DFACS, the private provider community, and we feel like it's a year when we need to make sure that there's some equity and some the
Well, let me ask you
resources.
this, and I don't mean to take, I don't mean to, but what if we took some of his money and gave it to him?
Oh, yeah. That would put us in a
I
great.
think we'd all get in a lot of trouble, basically.
I'd probably be skinned alive.
You know, we'll explore and we'll have a, you know, we'll continue to talk about it as we do.
57%, was that what? We just give him 50%.
Well, another area that Dr. Cagle mentioned earlier, and numbers will start being fleshed out better in the days to come. But that $28 million you heard that is in out-of-home care enhancements for care. If indeed we've plateaued and started leveling off, when I was director of DFACS, we had 7,500 kids in out-of-home care. So I can't even imagine having 16,000. So if indeed we can start getting those numbers down, maybe there can be some reallocation of those dollars into rate increases for these services that are needed. So that's an idea.
And that's exactly what Leo and I have talked about on it, particularly, is trying to look ahead toward that day. But we do have to deal with the reality of what exists today. So I thank you for continuing to bring it forward as it should be, and for the work that you do. It's amazing, and I thank you.
Thank you.
And next, John Blinn from Goshen Valley.
A delight to be here to see some of you who have met. Some of you have been to Goshen Valley. I've recently had my 70th birthday, so I want a certain bit of executive prerogative in this discussion and say that for the last 5 years, I have had a spectacular civics lesson from all of you in this room, and I really appreciate it. It capped what I thought was a great career in Wall Street, turned out to be small potatoes compared to working with kids and watching the wrestling and the well-intendedness of all of us as we try to make this work in good times and in not such good times. So I have huge regard for the gentleman over here, and I have huge regard for the team right here. And my son is taking over Goshen Valley from an operations perspective, so there's a blessing. But I'll continue to be involved in public policy matters that are important for the youth in Georgia. I want to thank you publicly and together for the 1.5% you did last year. Let me net it out quickly relative to Goshen Valley. It's $3 a day per child. Now that doesn't seem like a lot in our life with Starbucks and all the other places that $3 can go. But let me tell you that last year, Goshen Valley's operating losses were reduced by $53,000 annualized because of your commitment to the youth of Georgia. When it looked like there was no room, you rearranged a few things and sent the most encouraging message to us. It was not dilutive to Director Cagle, which was important. By the way, you cannot have a strong provider community with a weak DFACS, okay? Let me give you that as a gift of my time in this. We work in tandem, and we also work sequentially. So it's important that the governor take the steps he took yesterday to remedy matters that are longstanding at the division. And we are thankful for that, and all of our teams are. But I would like you to consider, as you did last year, and Representative Benton, I appreciate how you framed that. You scrambled around and looked for that, and I remember the look on Ms. Katie's face as she went through that process. So I say to you, would you consider yet again a bridge investment in the provider community? I believe that the investment you've given Director Cagle will pay itself back handsomely and quickly. I think you'll see the churn drop. I think you'll see faces light up. I think he's already seen it, and I've heard it from people yet just today about the impact that the governor's position has taken on the division. But we would like to know that we have to work together. There are 5,000 young people who woke up this morning in the custody of the private providers. So of the 14,000, I say good morning to 90 of them, but there's lots of John Blenns around in the private provider community. But your investment in us last year first sent a message to people like myself who aren't in this for kind of other reasons than they feel compelled to be in it. That's an interesting meeting another day. But by sending that message to us, it meant the world. Now we have another year where the private provider community is not identified as a reimbursement increase. And I understand that. I can understand that as a business person, how there have to be priorities. I would like you to consider remedies that are available to you, and I realize that you can't ask the governor to recast this, but we can take a look at allocations, I think. And I want to tell you that the private provider community sails close enough to the wind that your investment in this will mean something. An example would be Director Cagle and his team came to the private provider community and said, census is going up. We re-engineered the ranch in a year by remodeling our houses, which you saw when you were up there, so we could take 8 more youth. It doesn't sound like much, but if there's 100 private providers and each could take 8 more, we would be on the backside of a census challenge. So these investments that you make, which might seem modest, are not at all modest. They compile and make an opportunity real for the kids of Georgia. This money that you provided to us, it didn't go to better debt service. It went to the youth. I can promise you that. It went to the youth. Programs stayed open. Beds became available. Less hoteling. More care, hope, purpose, peace, all those good words. And I think that's what we've got in front of us today. I should say we. It's a team effort. I would like you to consider helping again yet with a bridge investment and look to next year when we can understand that a strong division makes for a strong private provider community. If you can address some of that this year, God bless you. If we wait, we wait. The kids are safe. We are fundamentally strong. We are committed. We're going nowhere. We just need to feel the embrace of the legislature and the governor by way of making business models that are sustainable. And that lies in this room as much as in my room. Those are my remarks. Thank you very much for giving me some time today. Questions about Goshen or Wall Street advice? Excuse me. Yes, thank you very much, Mr. Benton.
Any comments or questions from the group?
Miss Mary, it's nice to see you today. Thank you.
You know, I think you know that you have our heart.
You know
that you do.
This
and,
is
you know.
What a foxhole. I wouldn't want anybody else. Thank you.
Thank you. Thank you, thank you. Okay, so next I think it is Carl Lehman, is that right, with ChildCon?
Hi, I'm Carl Lehman with ChildKind, and I'm wearing 2 hats today. Actually, the one I did forget was the one I need to wear over my bald head when I'm outside, but the other 2 I brought. And the first one is, for the last 10 years, I've been on a committee called the Child Protective Services Advisory Committee, and that's kind of a long thing, but it's part of the CAPTA funding that DFACS receives. And way back in 2013, our committee started looking at turnover rates in DFACS, with the logic was that, you know, if the charge of the committee is to guide or assist DFACS with, you know, child protective services, how can you have a robust child protective services if your staff turnover is high? So, to make a long story short, I attended several different committees over the last couple of years, but when I heard about this increase for the DFACS workers, I, like you, Madam Chairman, I was just like, yes, because we had been advocating for salary increases, and Bobby can remember, and even Ron probably can remember, we've been advocating for that for years, and it never seemed to go anywhere, but finally, that's really exciting. So our committee, all of the committees, I think, wholeheartedly endorse this and hope that y'all will consider that positively in the budget. And secondly, the other hat I'm wearing, I'm the president of Together Georgia, which has been an interesting experience on my first 6 months. And I also, from that perspective, we work a lot with DFACs, and a robust DFACs workforce is absolutely critical to the success of ChildKind. And let me just give you a little example of what a partnership can do, if you bear with me. Is we work with children with medical complexity and developmental disabilities, and we got a referral once of a child who was in state custody because this individual's caregiver couldn't access support services. So the individual developed bed sores or whatnot, ended up back up in the hospital, and he ended up in foster care. So when we looked at this case, this was one of those things you look at and you think, my God, why was this child ever in foster care? This should have never happened. So we work with DeKalb County DFACs, which is a great program, and with some staff at Eggleston Hospital, and we put our heads together and say, how can we stop this from happening again? So we developed a program we call Home-Based Services, where we provide intervention work for children with significant health issues or developmental disabilities. And what we've been able to show is, yes, the program does prevent out-of-home placement, but we also saw that the issues that cost Medicaid so much money on this population of children relate to the same thing that gets kids in foster care. So we were able to document through Department of Community Health a 49% reduction in Medicaid claims on this population of children, largely due to a significant drop in hospitalization rates. So when you have a robust DFACs workforce and creative providers who can work together, it's amazing what you can accomplish, and things that might not necessarily appear in the budget, you might not actually be able to quantify the return on your investment without some more detailed analysis. But I also want to encourage you all, as a provider and representing all the providers in Georgia, that you consider the rate increase. That ChildKind, we're a nonprofit provider. Last year, 92% of all of our expenditures went to program services. We're very proud of that. We run a lean machine. And as John said, we can guarantee you the money goes to the children. We don't have fancy offices, or I don't have certain things that would be great to have. I also come from the world of banking, and I don't have some of the things I used to have. But I didn't work in Wall Street. I worked at the cesspool, which is known as Washington, D.C. in political banking. But it's great to be in Georgia. Anyway, so I also want to encourage to really take a hard look at parity of per diem rates for foster parents. That I just strongly believe if you're a foster parent, no matter what agency you're working with, public, private, if you're handling a child with a particular condition, you should get the same rate. So if it's a traditional base kid, a DFACs foster home, or a private provider foster home, the parents should be able to get the same kind of support. So are there any questions?
Are there any questions or comments from the committee?
All right, thank you.
Thank you, thank you. And thank you for the work you do every day. So next up is Zach Nikonovich Khan. Did I do that right? Kinda? Okay, you come correct me, okay?
Good afternoon. My name is Zach Nikonovich Khan. I always feel like I should apologize for that because I know it's difficult to say. I am here on behalf of Families First. I'm the public policy advocate for Families First. We're a large nonprofit social service provider. We provide social services to low-income families. We're celebrating our 127th year this year, and we provide services to about 40,000 clients every year. And one of our biggest programs is foster care and adoption, and I'm here on behalf of our foster care team today. And I had a whole speech and presentation prepared, but Ron Scroggy said it almost word for word. So I want to be mindful of your time and not repeat what he said. But just from the private provider aspect, we do really support and encourage you to consider the per diem for our foster care parents and foster care parents who are in the private provider organizations, such as Families First. So to reiterate what Ron said just briefly, we were thrilled at the governor's announcement yesterday. We know that this is long overdue, and we're very excited about the per diem increase. We just hope that you will consider going forward also per diem increases for foster care parents who are parenting through private organizations. Oh, and just quickly, we have 28 families who are foster care families and 45 foster children. And I'm happy to answer any questions you may have.
Are there any questions or comments? Well, Nick, thank you, and thank you for the work you're doing.
Sure,
for those
thank you for your
children and
time.
families.
It's Nikonovich Khan.
Nikonovich.
Yeah, it's a hyphenate.
Nikonovich.
Yeah.
Nikonovich.
It's 2 words, yes. Thank you.
I promise you Nick, I promise you. Nick, I can promise you I probably won't say it right the next time either. But I'll try really hard. Okay, and last on our list is Bob Bruder Matson.
Bob's unable to be here.
He's not here. Okay, he's with Faith Bridge. Anybody want to say anything? Was he coming to us about some of the same? Okay, great. That's wonderful. Well, from the committee, any other questions or comments right now? We will meet again, and I should know the room is at 606 over in CLOB tomorrow morning at 9 a.m. I don't think it'll be very long, mainly behavioral health, but very important presentation as well. So I look forward to seeing all of you then, and thank you for your time, and thank each of you for the work you do every day.